Hi, I'm Dr. Annette Hulse. Welcome to Think Like an Osteopath. One of the questions that we often get in this profession is what's the difference between an MD and a DO degree? That question can come from patients. It can also come from students who are interested in pursuing medicine as a career and wonder what's the best fit for them. There's lots of ways to answer that question. This is my answer. What's the difference between an MD and a DO? Well, really not much. In specialty training, where we learn to become a psychiatrist or an obstetrician or a neurosurgeon, there's literally no difference. MDs and DOs are all together in the same residency programs. In our basic medical training, in medical school where we get our degree, it's 95% of the same. But there are a few subtle differences. So let's look at those. We're going to start by making a couple of observations. Most, but not all, MD schools are associated with a research university. Most, but not all, DO schools are community-based. Another observation is that fewer than 10% of U.S. trained MDs will end up going into primary care, whereas almost 50% of U.S. trained DOs go into primary care. As a result of these two things, 95% of the education is the same, but there is a little bit of difference in flavor or emphasis. You'll see DO schools tend to emphasize primary care topics like diabetes management, asthma, or congestive heart failure, whereas MD schools tend to put a little bit more emphasis on new and emerging technologies like gene therapy, immunotherapy, or AI tools. So that's one difference. Second difference is the osteopathic philosophy. The tenets of osteopathic medicine are the body is a whole. It's a unified single organism, not a bunch of systems put together. The body has innate self-healing and self-regulating capability. Structure and function are reciprocally interrelated. We're going to come back to that in a minute. And that rational treatment is not limited to, but incorporates these first three principles. As a result of these principles, DOs are often considered more holistic. Now, it doesn't mean that an MD can't be holistic, many of them are, but it's not baked into their medical education in the same way. The third difference is that while all medical students are trained in the basics of the different parts of medicine, pediatrics, surgery, radiology, all DO students are also trained in the basics of osteopathic manipulative medicine, aka neuromusculoskeletal medicine. Just like most of us don't deliver babies after medical school, not all DOs do OMM after medical school, but some do. Some in primary care specialties will do it as part of their primary care practice. A few people in specialty practices, like neurology, might do it as part of their specialty practice. And then there's a few of us like me who do osteopathic manipulative medicine full-time as our primary specialty. Now, MDs can also learn osteopathic manipulative medicine, and indeed a few of them go on to become specialists in it. But they're not taught it in medical school, they learn it after they graduate. So what's the difference between an MD and a DO? Well, ultimately not very much. The specialty training is the same, the basic training is 95% the same. And for patients, the difference between individual practitioners is much bigger than the degree they hold. Nonetheless, because of these differences in emphasis, they tend to attract different kinds of students. So if you're a pre-med student, it's worth paying attention to who you are, how you learn, what you value, and what kind of doctor you want to be to figure out the best fit for you for your medical training. So I hope that helps answer the question, and thank you for joining me on Think Like an Osteopath.